My name is Amer and I am the Nuclear Medicine Coordinator, and I'm also a Nuclear Medicine Technologist. PET stands for Positron Emission Tomography. It's a nuclear medicine test in which a very small amount of a radioactive liquid is injected into you. We then use a scanner to detect where that radioactive material has gone. In PET, we use a common substance called FDG, which is like a simple sugar. When we inject the FDG into you, that will go to a particular area of your body, mainly the tissues and the organs. We then use the detector to take images of your body to determine where that material has gone. The PET scan is used to diagnose certain types of cancers, heart disease, and other diseases. PET scanners are now often combined with CT scanners. The CT scanners use X-rays to make images of slices throughout the body. These images are then combined with the PET images so that we can better localize where we are seeing any particular disease. For the PET scan, we would be giving you specific information on what to do and what not to do. If you have any questions, you need to let us know prior to your examination. We would ask you to refrain from eating, as this could affect the sugar metabolism in your body. Drinking water is often okay. If you are pregnant or think you may be pregnant, you would need to let your doctor or the technologist know before we would proceed with the test. If you are breastfeeding or if you are looking after young children, you will need to let the technologist know this, as we would need to give specific instructions on how long to stop breastfeeding and also how long to keep your distance from young children. If you are a diabetic, you will need to let us know, as we may need you to stop certain medication prior to your examination. When you arrive in the department, a technologist will greet you. We will bring you into our PET preparation area, where we will ask you to get changed into a gown. If you are wearing any items that do not have metal on them, then you are welcome to keep your own clothing on. Once we get you settled on the bed, we will be putting an IV needle into your arm. This is a small needle that we then attach a small amount of tubing to. Once the intravenous is in the arm, we will take out a small blood sample and check your blood sugar levels, as if your blood sugar levels are too high or too low, this can actually affect the quality of the PET scan. Once we have checked your blood sugar levels, we will then administer the small amount of the radioactive material. Once we give you that injection, you are lying in the room for about 50 minutes, just resting quietly. We would like you to remain as still as possible and refrain from talking. We would not have any visitors stay in the room with you. As you are giving off a small amount of radiation, we would try and keep that minimal to any visitors in the room with you. When the 50 minutes are up, we will ask you to go to the toilet to empty your bladder. After that, we will take you into the scan room to start your scan. The scan itself is not difficult. You'll be lying still and breathing normally, but we do like to make sure that you're as comfortable as possible. With the scan, there are two components. There is the CT component, which is quite quick. It takes about 2 minutes only. It will depend on the type of scan that we are performing, but usually the PET scan should only take about 30 minutes to complete. You should allow 2 to 3 hours for the whole procedure, as we do need time for preparation, performing the scan, as well as checking the pictures. Once we complete the scan, we will ask you to wait while we check the images. Sometimes there is a need to perform more images after we do this check. Sometimes, for certain procedures, we may need to put a small catheter into the bladder to get better images. We would let you know if we were going to do this when you were booking in for your procedure. The substances that we use in PET do not give you any side effects, so you should not look or feel any different. Unless your doctor tells you otherwise, you can resume all normal activities after your PET scan. Our role as a technologist is to perform the injections as well as perform the scans. We then check the pictures and send them through to our radiologist. They will then interpret the images and prepare a report for your doctor. this may take some time.